Welcome to the Confidence Through Health podcast. My name is Jerry Snyder. As a health, wellness, and sports performance coach, my goal each week is to bring you experts to help you take control of your health and build your self-confidence. Thanks for including me today on your journey to better health. I'd like to thank our sponsor for this episode, All In Health and Wellness. If you're looking for a health coach, you're looking for a sports performance coach, you're looking for nutrition guidance, like for instance, a meal-by-meal plan that will help you understand how to eat. It will teach you how to eat, and it will give your body, your cells, the proper nutrition to feel great and be able to perform at your best, not just physically, but also emotionally and mentally. If you're looking for those things, you're looking for the key to improve your sports performance, both from a nutrition standpoint and an exercise physical standpoint and a mental standpoint as you approach your athletic event. All In Health and Wellness is able to help in these areas. Go to allinhealthandwellness.com and you'll find the contact information for how to get in touch with them and get started on the plan that will improve your life. So Dean, I want to thank you for being a guest on the Confidence Through Health podcast.
Absolutely. I'm glad to be here and thank you for allowing me the opportunity.
So as we were talking a little bit before, I found it like it's actually sort of similar to my like journey into my career as far as like how because I was a junior in college when I decided what I wanted to do, and I went into school for engineering, and I'm like it's almost as far away from that as you can get now, with health related stuff. But so tell us a little bit about like how you got into the idea of going into physical therapy. And then we'll get into how you branch that into dealing with sciatica.
Well, I got into physical therapy sort of just out of nowhere. I didn't know what a physical therapist was. I never had any injuries. But my junior year in college, I was trying to decide what do I want to do with my life. And literally, physical therapy popped into my head. I thought,
Yeah.
what's a physical therapist and what do they do? And the following day, I called my folks and just said, hey, I'm just looking for direction here. You guys have any ideas of what you see for me in my future? And my mom, this is the day after I heard physical therapy in my head,
Yeah.
said, have you ever thought of physical therapy? And I went, where did that come from? And she told me that she had been taking somebody to physical therapy. And whenever she did, she saw these people and they all reminded her of me.
Yeah.
And she just said, it looks like it would be a great fit for you. So there I was, a junior in college. I had no science background in college. I didn't have any of the prerequisites, and
Yeah.
so I scrambled summer schools and during the year just trying to get all my biologies, physics, and chemistries out of the way, and
Yeah.
that led to physical therapy school, and it's history now. But yes,
Yeah. Well, it must have been something you did have an aptitude for because it's not exactly easy to completely switch and then pick up and go like, yeah, I've never really thought about these classes before, and I'm going to go ahead and get great grades to be able to get in physical therapy school.
it was a challenge. I was in school. It felt like 24/7, 12
Yeah.
months out of the year because I'd come home from Chicago to Phoenix. I'd get into a couple community colleges to get all my biologies, physics, and chemistries out of the way, and then go back to school and load up on the other chemistry, physics, and
Right.
biology that I didn't get in summer school. So,
Yeah.
yeah, it was grueling, but very much worth it now looking back.
Yeah. And then so you started your practice, you're working as a physical therapist, and like you mentioned before we started recording that you were seeing results, but not really the results that you wanted in some of your patients, and in trying to figure out how to help them. And in lower back pain, sciatica, those are things that are like pretty common.
Very common. I think the stats are 80% of people are going to have some type of low back issue throughout their
Yeah.
life. A lot of those are associated with sciatica, but not all of them. But yes,
Right.
very, very common. And it was one of for me specifically, sciatica was an area where I was not being very successful with my clients and it was driving me crazy. And I would
Yeah.
go to every class I could. I would take every back gurus class and online, in person, flying all over the country. And nobody really had a unique approach it was, to me, what I call now the generic approach.
Mhm.
Because if you go to a physical therapist now, they pretty much know what they're going to do for you and with you before you even get there if you have a
Right.
diagnosis of sciatica, which to me is like, wait a second, everybody's different. Everybody's body
Yeah.
responds differently. It's sort of like saying
Yeah.
if someone comes in with a headache, they're only getting Tylenol for a doctor. It's like, well, wait a second. Some people can't take Tylenol. Some people respond horribly to Tylenol.
Right.
And that's what it was like for me, dealing with my sciatica clients, where I was getting about a 20 to 25% success rate. And to me, success is at least 80% improvement
Yeah.
while they're seeing me.
Yeah.
So I was not satisfied with that.
Yeah. Well, and like to your point of already having your game plan wrapped up before you even see the person, like not even recognizing that, some of those diagnoses could be wrong,
Absolutely.
right? It could be something else there's lower back pain, but there could be something else that's not necessarily sciatica. And so if you're treating something without addressing the patient and truly getting to know them in their body, you could be like just not even helping, not you could potentially make it worse.
Absolutely. And I found that I was making a lot of clients worse. And it was strange because my thinking, I'm a guy,
Mhm.
so I'm dealing with these people. 20 to 25% of the clients were getting better, and they were telling me they were doing everything at home the way I told them to, and it was reflective in their response.
Yeah.
So my thinking is obviously the 75 to 80% of people who weren't getting better, it was obviously their fault, not mine, because they weren't
Yeah.
following what I was telling them.
Right.
And come to realize, sadly, that it wasn't them, it was me.
Yeah. Yeah.
Yes.
So, and I find this with a lot of people who are challenging like the norm, especially the traditional way of doing things, whether it's physical therapy or any other part of life, is that you go somewhere, you hear something from someone, and the light bulb goes off.
Hmm.
And it's like, oh wow, wait a minute. Like it's not just a matter of, oh wait, this could be something. Let me go down this rabbit hole. But it's like the light bulb goes off and you go, that's what I've been missing.
Right. And it didn't quite happen for me like the light bulb right away. But what I did realize, I went to this course. It's called Total Motion Release.
Mhm.
The gentleman who founded it, his name is Tom DeLonzo Baker, great friend of mine now. But when I was listening to him in this course, he was basically teaching everything 180 degrees opposite of what I had learned in school. And he actually started the course by saying, hey, everything you've done in physical therapy, I want you to throw it out the window because I want to retrain you.
Yeah.
And I had been to some courses like that were just bizarre.
Hmm.
And I actually threw that stuff out and just went, all right, I can't
Right.
even do it. It's so wild.
Yeah.
But what he was explaining and everything he was talking about was, hey, why are we only focusing on the part of the body that's painful instead of looking at the rest of the body to see how can we affect that painful area without aggravating it further?
Right.
And one thing that I like to do and demonstrate with my clients is, as a physical therapist, we're trained if someone comes in with a muscle that's tight, stiff, and sore,
Yep.
the way to loosen it is to stretch it. So you're taking something that's tight, stiff, and sore and pulling it tighter, thinking that making it tighter is going to loosen it.
Right.
And oftentimes it just aggravates it. And for my clients and for people now, I say, hey, if you just had shoulder surgery and you're in a sling and the doctor says don't move it for 8 weeks, are you going to take your arm and just move it around thinking that it's stiff, sore, and achy? Now I'm going to move it around. It's no,
Yeah.
it's because, wow, there's a wound, there's a problem that needs to be healed. But
Yeah.
with sciatica, it's like we don't look at it as a wound that needs to be healed. We look at it as an area of the body that needs to be stretched, pulled, and dug on, which basically irritates it further. So
Right.
you were talking about the light bulb moment. I didn't have a light bulb moment until I came back to my clinic and treated my first client with this principle. And it was jaw dropping. I was just dumbfounded at the
Yeah.
results that I saw. And
Yeah.
that's when the light bulb went, I wonder if this will have the same effect on my sciatica clients.
Yeah. And so for people that don't know, and I think I've, being in the health world, a lot of people, even though I don't deal with lower back pain specifically, but just being in the health world, a lot of people will say, "Oh yeah, my back hurts." You have any idea what that would be? I think it's everybody tells me it's sciatica, and I'm like, okay, well, Dr. Google or whoever you want to, your 10 best friends that have all had injuries or whatever. Like, what is sciatica, and what's the like difference between like just lower back pain and sciatic pain?
Great question. Sciatica to me is just a generic name, um, basically saying that your sciatica nerve is irritated somewhere along the line. And the sciatic nerve is the longest and the thickest nerve in the body.
Yeah.
It runs from five of the lower vertebrae level nerve roots come out and they combine and form like a thumb size thickness nerve that runs down right through the center of your butt, down the back of your hamstring,
Hmm.
and then it splits behind your knee and forms two nerves that go down all the way to the toes. So
Okay.
sciatica is any irritation of that sciatic nerve. And it can, and I tell people, think of anything that you think a nerve pain can feel like. It can cause numbness, it can cause tingling, it can cause electrical like shocks, it can cause some cramping, tightness, stiffness, soreness, anything that you can imagine that a nerve can feel like.
Yeah.
And the pain for sciatica can be anywhere from your low back area all the way down to your toes, different areas along that track. It doesn't have to be consistent.
Hmm.
And so it can be anything from a little bit of a nuisance for many people to severe debilitation for most
Yeah.
people.
Yeah. Um, and so but there is other lower back pain. It's just, like, okay, I'm stiff because my muscles are not working right. It's not necessarily the nerve, right?
Absolutely, yes.
Yeah.
And sciatica, about I think stats show 75 to 80% of the time, it's from a disc issue that's pushing on the nerve.
Mhm. Yeah.
But there's so many other causes. But yes,
Yeah.
you can totally have back issues without having sciatica. And what's wild is most of my sciatica clients don't really have any back pain, even
Oh,
though
yeah.
the source may be in the low back. But it's because of the area, whatever part of the nerve is being pinched or irritated, that's the area from your low back to your toes that's going to be affected.
Gotcha. Gotcha. So, so I'm like, to go back to your, like, working the opposite side,
Hmm.
right? And yeah, I think I've seen a lot of people like, oh, my back hurts. Okay, I got to stretch. Oh, stretch everything out, right?
Hmm.
So if it is, whether it's the right side or the left side, like I'm assuming how often is it both sides? Is it
Um, Bilateral sciatica is not the norm, but it's not totally uncommon either.
okay?
I would say 85 to 90% of people have it on one side.
Okay.
Some people have it switch from side to side depending on what's causing it and depending how their body's compensating for those
Yeah.
pains.
Yeah.
But yes, and I always say working the opposite side, but that's just to get people's attention to realize they don't have to only work their painful side. But
Right.
oftentimes, if someone has sciatica and I have them do a rotation movement, oftentimes rotating to the side of their pain is less painful. And
Hmm.
everybody goes, well, wait, that's my painful side. Why is that not as painful? I go, well, when you're rotating to your right, if your pain is on your right, all your muscles in your low back and your butt are compressing.
Right.
Whereas when you're going to your left side, all those muscles in the right low back are stretching. And so, depending on whether your body is more comfortable with compression or stretching, is going to determine where your symptoms and which side
Right.
you're going to be exercising.
Right. Um, so in theory, and like in my head, what I'm seeing is, and I actually told one of my running athletes this the other day because his his running form, he was twisting, and you could tell his left arm is not as strong as his right arm, and so he was getting weak and just starting to flail. And I said, okay, I want you to do these dumbbell exercises to strengthen your shoulder girdle so you can have more stability there. And I said, but if you do the same number of exercises, same reps, same weight on both sides, you're still imbalanced. And he was
Exactly.
like, what? And I was like, yeah, you've got to do, I said, I want you to do 25%, 50% more on the left until we can see that it's normal on both sides, symmetrical. Then we can go to the same weight on both sides, same reps, and
Very
so I'm seeing
interesting.
the same type of scenario there, same type of connection.
Yes, and you want to know what's wild? When I took this course 16, 17 years ago, the gentleman started by pulling three smaller girls up to the front, put 8 pounds in their hands, and said, "Can you lift these to your side?" And they all went like this. Their strong
Yeah.
arm, their dominant arm was straight out, their weak arm was lower. And he said, "Okay, all you therapists and trainers, what do you want to do to balance these people out?" And we all said, "Strengthen up that weak side."
Yeah.
He said, "Check this out." He put 10 pounds in their good hand. He did two sets of 10 in their good hand. Then he put 10 pounds in both hands.
Hmm.
And he said, "Lift these." And they all went like this. So their weak side got stronger by working their stronger side with more weight.
Huh.
And I
Wow.
sat back, and that's when I sat back and went, all right, maybe I'll listen to this guy because that was pretty cool.
Yeah.
So Not to contradict what you just
No,
said,
but
but
that's
what I have found is that when you are working a weaker part of your body is going to try to compensate to get it
right,
stronger.
right.
When you're working your strong side, your body's not going to compensate because it's easy. And what happens is you get a carryover effect, and the weaker side actually gets stronger when you
Interesting.
work the stronger side more.
Interesting.
It's kind
I'll
of
have to try that
bizarre.
out.
I mean, I sat back and then I've tried it on patient after patient after patient, and I have yet to see it not work.
Right. I'll have to try that out.
Yeah,
But so either way though, it does come down to that looking at it and going, okay, we have to change the way we're doing this and addressing that compensating factor, right?
absolutely.
And
Yes, because when you're
I've been injured many, many times as a runner,
Mhm.
right? Like little injuries, big injuries. And I can totally see like I've got a knee injury where I've got a torn PCL, never had it. It was completely ruptured, never
Hmm,
replaced it because all I do pretty much is, in a forward plane.
right,
I don't do a lot of other movements anymore. Um, and I have a brace for that if I do. But like, so I don't have to worry about that so much. But because it's not as stable, like I get compensation injuries all the time because of that
absolutely.
I have to work through, like little bitty things. And I'm like, oh, that's because of I'm compensating, right? And my physical therapist, yep.
Yep.
I'm like, okay. So it's given me a new like, okay, now I've got a different idea of how to address this instead of just automatically going to the left leg where the injury is and
Hmm,
saying, I've got to make you stronger.
right. Yeah, because well, I'll relate it to sciatica. When someone has sciatica on the right side, the body's natural response to it is all right. The body wants to protect that right side as best it
Hmm.
can so no further damage occurs, which means everything in your body is now going to be compensating because those muscles are not functioning normally. And I tell people, think of somebody walking around on a sprained ankle. Why is their
Hmm.
head, neck, and shoulders doing this when the problem was way down low? It's because our bodies are awesome at compensating, number one, to try to protect the area that's a problem, but number two, so that we can continue to function.
Yeah.
And people with sciatica go, well, I'm not having any less pain. I go, but you don't know what it would feel like if your body wasn't compensating. It's compensating so that you can continue to function with as minimal pain as possible, even though it's
Yeah.
hard to believe that that pain is minimal.
Yeah.
But now that you have imbalances throughout your body, now you have extra physical tension and stress going on in your
Right.
body, which is causing those muscles that are protecting to have to protect even more.
Yeah.
Because just like pulling on a chain, the area that's going to get stressed the most is the weakest area. So the weakest area in your body is going to be absorbing all these extra tension and stresses. And if you don't address those and just focus on, okay, let's take care of this, or let's take a pill and take care of it,
Right.
you can take a pill, knock down some of the pain, but your body's still straining. And when that pill wears off, guess what? You're probably going to be in more pain because you've ignored all the signs of your body
Right.
while your symptoms were masked.
Right. Right.
So,
And so when we're trying to exercise and strengthen those areas that are our compensating areas, right?
mhm.
We're avoiding increasing injury. We're going to those other areas. Is it is it also though dealing with the pain factor there of like, okay, wait, I'm starting to create pain in if it's my left lower leg that I'm feeling because the sciatica nerve is hitting that down, I'm trying to strengthen the other parts, but I'm starting to feel it in left leg stop.
Absolutely.
Or
I always say pain is like the warning light in your car.
Mhm.
And I think we treat our cars a lot nicer than we treat our own bodies. Because when the
Yeah,
warning light's going off, we go, if I don't get this in, it's going to be a big problem. Guess what? If you don't take care and stop when your body's going, hey, a little bit of pain here, a little bit of pain here, um, it can cause a much bigger problem.
yeah,
And one thing that I do, well, my three-step approach to healing sciatica is number one, I want to get the body balanced first. Everybody
right,
says, hey, you know what? If your core is strong, you're not going to have back pain. And every study that I've ever read proves that that is a fallacy.
right.
It's not bad to have a good core strength, but core strength isn't going to heal a problem if
Yeah,
there's an underlying issue going on. So, number one, if you don't balance out the imbalances in your body, then your body can't function normally. And what I've noticed is
right.
when we balance people's bodies out, their body's naturally stronger because their muscles are working as they were intended to when things are balanced.
Yeah,
So once we balance, then we strengthen. I don't want to strengthen before we're balanced because you don't want to reinforce those imbalances.
right.
So you
Yep.
balance, strengthen, and then get back into doing what you normally want to do slowly and steadily because your body just needs time to heal even once it's balanced and stable.
Right. And that's a very similar thing I do with runners because when I take runners and have them for the for a first session or two sessions, I'm like, okay, you're not going to sweat. And sometimes it's like I'm in Texas, and I might meet them the first time in the summer, it's 100 degrees, and I'm like, okay, you'll sweat because we're outside, but you're not going to sweat because of anything I'm doing.
Right.
Because I got to see how your body moves, and it's very similar. I use the same thing. I want to be symmetrical. I want to be balanced because
Hmm.
otherwise, if we just start running and pounding and trying to make you faster or stronger endurance wise, like if there's an underlying form issue, it's going to show up at some point down the road when we don't want it. And then we've just reinforced everything.
Absolutely.
And so it's like break it down and start over, basically start over at ground level and say, okay, let's let everything heal, let everything come to like you said, a balance, a symbiosis, and then be able to pile on top of that as we
Absolutely.
can, comfortably.
100%. And that's the thing. So many people try to, um, well, as a physical therapist, we were taught initially, hey, no pain, no gain.
Right.
And I can't imagine how many people, well, I can't imagine. Thousands of clients that I pushed through their pain to try to get to the gain.
Yeah.
And no pain, no gain is great if you're 18, 19, or 20 and you're trying to get into the Marines. That's
Right.
a different
Yeah.
type of no pain, no gain. But
Right.
when someone's in pain, pushing them through pain is just going to cause their body to resist more, compensate more, get out of balance more, and you're just going to be dealing with problems down the line that you
Yeah.
shouldn't have had to had you balance things out first so that you didn't have to push through pain to get gain. You
Right.
were comfortably gaining.
Yeah. And that's like for people that are looking at it and with all the different, like, I mean, technology's going nuts, right? In the last,
Hmm.
I mean, 10, 15 years, it's exponential and all the stuff that's coming out in the health world. And so looking at it going like, okay, well, there's ways both just through more knowledge of what we have and how to treat our body, but also there's going to be, you know, laboratory induced ways of extending life, right? Longevity. We're going to
Hmm.
be able to live longer and I know people I've said stuff on Facebook about like, oh, I'm looking to live this far, and that's why I'm doing the things the way I do them. And one of my friends wrote back and was like, "Why in the hell would you want to live to 80?" And I was like, "Oh, okay." And he's like, "You're gonna be, decrepit. Your body's gonna be falling apart." Da, 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 da. I'm like, "No, well, not if you treat it right early on
Now,
and now, right?"
right.
And so, like, and sciatica can happen to anybody,
Hmm.
right? Because it can be an acute injury induced, or it can be, an overtime thing, right?
Absolutely. Yes.
And so from an age standpoint, it's not something that we necessarily need to wait and go like, okay, now I'm an old person, and so these things are supposed to happen, and I have to deal with them.
Exactly. It's like, hey, why don't we start taking care of our bodies now so that later on we don't have to deal with it? It's
Right.
sort of like most of the health issues that we're seeing now in older people started 20, 30, 40 years ago with their
Right.
diet, with their lack of exercise, with the way they live their life. And yes, I think there's a lot coming around now. It's like, hey, you know what? If we deal with things now and we stay healthy now, guess what's going to happen later down the line? We're
Right.
not going to have to deal with all the issues that our parents and grandparents did.
Right. And so as someone goes through like it, because you mentioned that a lot of times that the sciatica pain is because of a disc issue,
Hmm.
right? Um, and so how is it possible to okay, we've alleviated the pain, but can we fix the problem?
What they're finding in studies is that discs actually can heal over time. But
Okay.
what's even more interesting is that when they've taken studies of people at various ages, that starting at age 30 to 35, people get degenerative disc disease. That's just something that's sort of like gray hair, wrinkles. That
Right.
doesn't mean you have to have pain, you have to have problems. That's a normal aging process.
Right.
And disc bulges, normal aging process. You see it in higher percentages the older people get.
Yeah.
And one of my pet peeves is people want to jump into an MRI real quickly to go, hey, I want to see what's going on. And a couple things wrong with that is a lot of things that come up on MRI have nothing to do with your pain or our normal aging, like I just
Oh,
said.
right. Yep.
But the other thing is, most of my clients, when they have an MRI, they're laying on their back with their legs elevated in a comfortable position.
Oh, yeah.
So there they are in no pain.
Yeah.
They get an MRI result back, and the doctor goes, here's what's causing your pain. And I ask the patient or the client, were you in pain when you were laying there when they took that picture? Well, no. I said, then how can that be the cause of your pain?
Right.
If that's the cause of your pain, you should have been in pain when they took that picture.
Yeah.
And they go, oh. And then doctors come back and say, well, when they stand up and move around, I go, you don't know how that's moving
Yeah.
when they're standing and moving. So you
Right.
can't definitively say it. Sometimes there's a huge disc
Sure.
herniation, like on your S1 nerve, and the S1 nerve um, area of your leg is affected. It's like,
Yeah.
okay, there's a good correlation there. But most of the
Right.
time, it causes more frustration for people because people get in their heads, I have pain because I have a herniated disc. It's like, well, how come it's painful sometimes and not other times?
Right.
If you have a herniated disc, the herniation is not going away and coming back, going away and coming back.
Yeah.
It would be painful all the time.
Right.
So getting those things in people's heads sort of defeats them for no reason oftentimes.
Right. Well, and I can see the correlation there for like what we were talking about before of like the movement in stopping when you have pain,
Hmm.
right? And like, okay, so yeah, if more sciatic issues happen when we're standing or sitting because we're in a more vertical position for our spine, and so
Hmm.
that compression is happening, we're pushing down on those nerves, then like, okay, I can totally see that, okay, I'm gonna lay down, I'm not gonna have any pain because everything's gonna relax. Like, yeah, like it's you've got to be in the activity, if you will, that's causing the pain to then be able to say, okay, now we can identify, what it is and what should be causing that. Not necessarily always, but it like if you have pain bending over and touch from, your right hand to touch your left leg and that causes pain, okay, well, there's something in that movement that's causing pain.
Exactly. And one of the things that I try to teach my clients is you've got to learn how to map out your pain. And map is a mnemonic for what is the movement, what is the activity, what is the position that's causing your pain.
Hmm.
And when you find those, you're going to be either number one, you're going to be avoiding those initially because you don't want to just keep on aggravating the problem. Or
Right.
if you have to, I mean, for some people, it's sitting and they go, oh, when I drive, it's absolutely
Right.
intense. It's like, okay, well, we're going to have to find a position or find a different way of you for you to sit and drive so that you're not aggravating it as much. So you want to
Right.
either eliminate those things or do them a little bit differently so that you're not constantly aggravating and picking on that problem. Because I always tell people, hey, if you have a scab on your arm and you pick at it, guess what's
Yeah.
going to happen? It's going to bleed. It's going to start,
Hmm.
the healing process has to start all over again. In the same
Right.
way, you've got sciatica, and every time you sit to drive, it aggravates you. It's like, guess what? The more you sit and drive, the more aggravated it's going to get. So,
Right.
can we find a way to either sit and drive, whether it's a position of the seat, the way you're reclining, whether you have a roll behind your back or ice pack under your butt? We've got to find a way to minimize that aggravation because otherwise, we're just going to be
Right.
starting the healing process all over again and again and again and again.
Right. Well, and that's one of the things that you mentioned, that one of the things that people always ask me when I tell them that I blew out my PCL and I never had surgery to repair it, and they're like, "Doesn't that hurt?" I'm like, "No, like there's no nerve endings in the PCL. Like
Hmm.
it doesn't hurt. Like I can do things that make it hurt because it then changes the positioning of the knee where it's not supposed to be, right?
Right.
Like because that's not holding it and giving it stability. But yeah, the other side of it is, okay, well, if it's a nerve, it's going to hurt. Like unless you like change something about how that nerve is being exposed or hit or impacted or crushed or whatever it is. Yeah, so if you don't address that, then it is going to be something that you're going to have to deal with. And it doesn't matter how much pain medication you take.
Absolutely.
You may be able to mask it for a little bit, but that eventually is going to go away. The body's going to say, no, there's injury, there's injury, there's injury. It's going to keep alerting you to it.
100%. Yeah. And most of my clients, it's sort of a progressive thing over years. It's like, oh, you know what? I used to get a little back twinge here and there,
Hmm.
and then it'd start going into my butt. And each episode seemed to be getting a little bit more. whether it was intense or the pain was traveling further or the episodes were lasting longer. And I tell them, I said, look, you probably calmed down that area, but you didn't address the imbalances. And so now these
Right.
imbalances over time, guess what? It's going to wear out and it's going to wear that area. Then you're going to treat it. It's going to feel better for a little bit. And then it's just going to keep on compounding until you actually take
Right.
care of the imbalances, stabilize yourself in that position so that you don't have to keep dealing with this over and over again.
Right. Right. So you don't have that, okay, I've been great for 2 months and you make one movement and go, oh, it's back. Well, it
Right.
never really went away.
Exactly.
Right. You just learn to not aggravate it.
100%. So
Yeah.
true.
Yeah. So for someone who is and what's neat is that you've developed a way for people to basically do this on their own,
Hmm.
right? So it's like
I have.
they can come see you and that's probably great, but they can do these things on their own. Is that if it's at a you know up to a certain level and then it's like, okay, wait a minute, now it's just too far gone, you have to see somebody, or does it work if it's truly sciatica that's the issue?
It's an interesting question. I've had clients who have been told that there's no way that they're ever going to walk again, drive again, unless they have surgery.
Yeah.
And I'm thinking of this one lady in Florida. Um, we met online. I do everything online. I don't even have
Mhm.
clinics anymore. So I do everything online. And we met twice. And in 2 weeks, the after 2 weeks, we got on another call, and she goes, "Dean, I'm walking, I'm driving. I know my limitations because for four, I was up and around 4 hours. She had kids, and it started to feel it again. So I realized, okay, I did too much. And this is
Mhm.
just after 2 weeks, and
Yeah,
that's not the norm. That was one of
sure.
those jaw dropping. Wow, that happened.
Yeah,
But yeah, what we teach people and what I've learned over the last 15 years is, hey, if I can teach somebody how to assess the imbalances in their body so they can fix themselves, they're going to be better off in the long run.
yeah,
So our programs last, we have 8 week programs that we take people through. They have an online course section, and then we do some coaching
yeah.
so that if they have questions, we can personalize things more for them. But usually after 8 weeks, most people are somewhere between 75 and 90% better, and they have the online course that they can always refer back to, or they can get in touch
Mhm.
with if they need. But my goal
Yeah,
is I want to be able to empower people to go, hey, look, you can take your life back. All during
right.
the 8 weeks, we're telling people use these principles in everything. When you're walking through the grocery store, if you start feeling pain, you know what? Try doing a little bit of a rotation one way or the other to see, does that calm the symptoms down? If it does, awesome. Calm them
Yeah,
down on your own. I don't want I don't want people to depend on me. I mean,
yeah,
I think I'm a pretty dependable guy, but I don't want people to constantly have to come back for help.
right. Yeah.
So
No, that's great. No, and I have a friend I already. I'm like, okay, he's getting your website as soon as we get off the phone. Uh, because he constantly asks me like, what do I do? Who do I see? What should and it'll it'll work for a short amount of time, and so I know he's getting more, the symptom relief than actually truly getting, you know,
the
healed,
healing, right?
that healing process that's got to happen. Um, and so for those people that are told you're never going to be able to do this again, it's just too bad, and then of course that spreads, right? Like,
Hmm.
oh, you don't want sciatica, you won't be able to do it. Like, I mean, I've heard all those horror stories from people of how bad it is. Um, how much of that in getting other, physical therapists or whoever it is in the medical field that's treating the old-fashioned way and not getting the 25% results, and these
Hmm.
people are in the 75% and they're being told like, yeah, there's just
Nothing we
nothing
can do for you,
nothing other than surgery.
right?
Um, like how frustrated are those people when they come to you and like in almost like disbelief of like, yeah, there's no way this could work.
Um, that's a great question because most people are extremely skeptical. Obviously, hey, treated many people. You know what? I went to the best orthopedic surgeons, the best physical therapists, the best chiropractors, the best massage therapists in my area. How can you help me when they couldn't?
Yeah.
I go, well, and their big thing is, don't you have to see me in person and get your hands on me? And I'm kind of a smart aleck in
Yeah.
ways, and I go, how has that worked for you so far? All
Yeah.
these people had their hands
Right.
on you. You saw them in person. and you're coming to me now asking me for help. So obviously that didn't work. Now, I'm not saying that seeing somebody in person or having someone put their hands on you isn't going to help you.
Sure.
For for most people, that's what they need, that's what they want, that's what they get, and they get the relief.
Yeah.
But there are thousands of people out there that are not getting the relief that they need, that have been told that there's nothing else that can be done. Those are the people, obviously, they're coming to me, they're very skeptical because if nothing can be done and their doctor, who's a specialist, says there's nothing
Right.
can be done, who am I? I go, well, I've been doing this for 15 years. I actually, the longest standing client or the longest suffering client that I have helped, he was dealing with it for 63 years.
Oh my gosh.
Um, it was, yeah. And after the first 5 exercises, he gave me a call and said, I can't believe this. I walked around my neighborhood pain-free for the first time in 63 years. And he
Wow.
was an 83-year-old man. He goes, I never would have believed it. All I did were your simple exercises. I
Yeah.
balanced my body out, and here I am.
Yeah.
And so I have seen jaw-dropping results probably 15 times in my 15, 16 years of specializing in sciatica.
Yeah.
Um, but I know over time when people balance their body out, stick with the principles work just simply
Yeah.
because, hey, you know what? Our bodies naturally are going to be compensating and out of balance when there's pain.
Yeah.
So if you can reverse those imbalances, the body is amazing at healing itself.
Right.
So, yeah, people are so skeptical, but I also know that probably 98 to 99% of the time, when those people have been told that there's nothing that can be done, there are more things that can be done.
Yeah.
And it doesn't have to include medicine or injections or surgeries.
Right.
I actually had a client he was um, considering his seventh surgery. He had had a back injury at work. He actually afterwards said, I was addicted to my pain meds.
Right.
And after 3 months of just going through simple things that I was showing him, he said, Dean, I went out and I mowed the yard yesterday thinking I'm going to be dead today like I normally am. He goes, I have slight amount of pain. He goes, but better yet, after 3 months, he goes, I'm off all my medications and I was addicted to the
Oh wow.
medications. He said, so that is probably a
That's
bigger
even bigger.
blessing
Yeah.
than getting the pain gone. He said,
Yeah.
but the pain is not there.
Yeah.
So um, I always tell people, hey, no matter what condition you're in, there's always hope because your body's going to be out of balance simply because of the way you've been compensating for
Right.
years.
Right.
So when everybody else gives up, I'm like going, hey, you are the exact type of client who I want to help because my average client has failed 3 to 5 other treatment approaches
Right.
previously.
Right.
And that's sort of a blessing in disguise because, hey, at least I know I can help people, but they're
Mhm.
coming to me more and more skeptical because they've been promised
Right.
the relief and promised, hey, you know what, if you have this microdiscectomy, you're
Yeah.
never going to have to deal with it again until the next microdiscectomy. And then the fusion that follows
Right.
and just the cyclical, horrible pattern that people get themselves into.
Right. Well, and I mean it's I've said this before too, is that the body will heal itself if you give it the right tools. And
Absolutely.
one of those tools when it comes to this is reducing inflammation in the area so it can heal and have time to heal. But if we're continually aggravating it,
Hmm.
whether it's by stretching and pulling the muscles or what, and like giving it the time to heal first, then going, okay, now we can start actually strengthening to make sure that we've got the muscle structure and the things in place to be able to prevent this from happening again.
Absolutely.
That's it's so often a step that so many people skip because whether it's a doctor telling them there's no other option or their just desire to like, no, I gotta get back to work or I gotta get back to life or I gotta be able to do this, that, or the other thing. And it's like so many times we forget that, and I do this as a runner when I have an injury. I'm like, sometimes I forget that, like, okay, maybe I just need to stop for a few days. Just tell me, my body's telling me, okay, just calm down, relax, you're
Hmm.
fine. Just let everything recover. You'll be able to get back to it and everything's gonna be great. And we forget that, and we just have no patience to be able to sit through that and let the body do its
And
job.
honestly, runners are some of
Hmm.
my toughest clients simply because they get such a release and
Hmm.
that's their way of just getting that euphoric runner. What's it called? The
The runner's high.
runner's high. Think, yeah,
Yep.
that was a tough one. The
Yep.
runner's high. They miss it. They want it. I'm like going,
Yep.
all right, if you want to experience that runner's high every day for the rest of your life, you got to stop a little bit now so that you can. Because if you don't stop, you're not going to be hitting that runner's high at all.
Right.
So
Yep.
and I always tell people, look, you're on an airplane. What happens when the airbags come down? If you have a kid, they say put it on yourself first. Because if you don't take care of yourself, you're not going to be able to handle
Right.
anybody else around you.
Yep. Yep.
So you do. You've got, I think, so many times, especially females more than males, they're always looking to take care of
Hmm.
everybody else. They have so many things pulling them in different
Yeah.
directions. It's the female patients. I go, look, if you can just take care of yourself now, everything else is going to be a breeze. But if you
Yeah.
keep on working on everybody else, you're just going to keep breaking down. It's going to get worse and worse.
Yeah.
So,
And there is, like with everything, there's a point of no return. Like there's a point where, okay, if that disc is what the issue is, there's a point where that disc is finally going to say enough is enough, and you will have to have surgery to get it repaired or get your spine fused, or but there's a lot of points along the way of that journey where you can stop and reverse it.
absolutely.
You
It's
know,
like that dash flashing light saying, hey, it's time, it's time, it's
yeah,
time.
and I've got a friend that's a surgeon, and like he it's funny because any little thing he'd be like, I can cut you up and take care of that. I'm like, no, I don't want to be like, I just need to learn to avoid this or the other thing that's causing the issue. He's like, and people always ask me why I haven't had surgery on my knee. It's been almost 8 years. Or it's been over 8 years now. And I'm like, but I don't want to be cut open if I don't have to be.
Right.
I had one orthopedic that was like, hey, if you wear your brace when you do these things, fine. If you don't have pain when you run, you can run without it and you'll be good. Someday down the road, maybe you'll need it, but why do it now? I was like, that's all I needed to hear,
Yep.
you know? Um,
And
and
that's a good surgeon because most surgeons would say, hey, I can fix it. Why worry about it?
mhm,
So, and that with back problems, it's like, oh, you've tried physical therapy, it didn't work. Let's cut you open. Well, what are you going to work on? Well, we'll figure it out when we get in there to see how bad it is. It's like,
yeah,
whoa, 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 whoa.
yeah,
I have some back surgeon friends who have refuse now to do back surgeries because there's so many failed back surgeries. And
mhm,
most of the time when they go in, there's not necessarily a definitive thing that they know they're going to do, even though, hey,
yeah,
the MRI shows this. But
right,
when they get in, then they realize that there's other things that are more serious than what that was. And then they go and fix it, even though that wasn't necessarily what was causing the symptoms.
right,
And so many times when people have surgery for sciatica, um, the sciatica pain is gone, but they wind up with significantly worse back pain because of the trauma that was caused
mhm,
to the spine from the surgery.
right.
So, and that's not saying that surgery is never necessary or that every
Sure,
surgeon out there
yeah,
is not doing what they should, but
sure,
I have seen so many times where it's like, hey, we did the microdiscectomy. And what's interesting is when they go in and take part of the disc out,
yeah,
um, here we go. When they take the disc part out that's leaking or that's
yep,
herniated, they basically cut it off. They don't patch the hole where it came out of because there's nothing that they've come up with yet that can
okay,
um,
yeah,
patch it accurately.
yeah,
So guess what happens? So for the next 6 to 10 weeks, there's no bending, lifting, twisting. If you cough or sneeze, you're at risk of putting so much pressure down there that whatever's left in the disc
it's gonna pop
can
out.
actually
Yeah,
blow right out that hole.
yeah,
And so I tell people, look, that you're basically for 8 to 10 weeks going to be not doing much. So why don't
yeah,
we try 8 to 10 weeks right now of doing what you can be doing to help heal
right,
it instead of the
yeah,
surgery? Because once they
yeah,
go in and take it out, they can't put it back in.
right, right.
So,
And like you said, it's not that surgeons are they're doing it wrong or they're doing what, it's they're going off of what they see.
mhm.
And one of the things I always tell people, especially when it comes to like athletes that are starting to have aches and pains, and I'm like, look, yeah, you need to go like ice it, do all the things to take care of it. But in the, invariably, especially my high school athletes, like, well, do I run through it or do I not run through it? I'm like, there's a pain level that I can't tell you what that pain level is because everybody's is
Mhm.
individual. Like that pain is telling you I have to stop. And my
Exactly.
pain tolerance is off the charts. Like I ran for 300 miles with a tear in my Achilles before I finally stopped.
Mm.
Like I've run races with stress fractures. Like my pain level's off the charts. So if somebody said like, what should it be? I'm like, I would probably put you in the hospital if you went to my pain level,
Right.
like because I put myself in the hospital. Like you don't want to be there. Um, and it's taken me 50 years, but I'm learning. Okay, wait, don't get to that pain level. Don't let that happen.
Right.
Um, but that's something that the surgeon has no idea what your pain level is truly, other than just this random chart of 0 to 10 that everybody probably says incorrectly.
Hmm.
Um, and so like understanding how to truly alleviate that, if we can do it without having surgery, and then the many other complications or issues that come from that, and rehab that comes from that, that could be messed up, that could cause other issues, that there's and that might be a small percentage of times that happened, but there's always an opening for other things to happen.
Absolutely.
And so if there's options like this where it's like, oh, let's just let the body do its job and properly help it along the way and get results in 8 to 10 weeks, like why not?
Absolutely. Yeah, those 8 to 10 weeks can last a lifetime.
Yeah, yeah,
Especially if you learn how to do it on your own, should you notice that something else occurs. And
right,
that's one thing that's wild about what we do. It's when you're balancing out the body, we're treating more than just sciatica. I've had so many people go, hey, you know what? My shoulder hasn't felt this good
right,
in so long. I said, that's because your whole body's been compensating. And now that everything's back in balance and relaxed, now your joints can move further. Now your muscles can function like they're meant to.
yeah,
And so I have my clients, I tell them, hey, look, if you have any other issues, apply the same principles. And if they're not working, come back because we'll be able to find some different exercise or different movements that we can
right,
find that are out of balance to help you.
right. Well, and how often does that happen where it's like, okay, the one pain is just bigger than the other pain, and so you
Hmm.
don't realize that there's also another issue because one just is, and it sort of like, okay, well, the engine light's going off saying, okay, this is the issue, and you take it in, and they go, oh, well, this is also something that needs to be addressed. Well, the engine light won't ever flare for that because it's
Right.
a different system. But they go, oh yeah, you should
Exactly.
probably address this too. And you won't get that until somebody looks at you or helps you through with some exercises from that professional touch and understanding of what's going on. So,
Absolutely.
so how can people connect with you, follow you? You mentioned a Facebook group earlier with a lot of people in it.
Yeah, I have a website. Everything I try to when I started studying business in school, I
Mhm.
learned the KISS method, keep it simple,
Yep,
stupid.
yep.
Um, so everything I do is sciatica relief now. I have a website called sciaticareliefnow.net. I'm on Instagram, I'm on Facebook. I think we actually have some TikTok videos out there now too.
Okay,
Or you can look my name up if you put in Dean Volk, Sciatica Relief Now. You'll be able to find me. I have a YouTube channel.
awesome.
Um, I'll give you some information too, so you can post with the podcast. Just
Yeah,
sort of a lead page that sort of tells a little bit about what we do.
yeah,
But yeah, I
awesome.
if you're dealing with sciatica and not getting the relief that you deserve, please feel free to reach out. I mean, this is what I'm doing. I had no idea I was going to be online as a consultant full time, but that is what I've been doing for the past 2.5 years solidly. 3 years now solidly. So
Yeah.
um, it's
Well, and I can imagine it gives you an opportunity to just reach so many more people.
amazingly so. Yeah, when
Yeah,
I basically started a Facebook group in 2018 on a whim, and I had no idea that I'd be able to sell my clinics and be busier now than I was when I was
yeah,
overseeing my staffs and having 3 different clinics that I was
yeah,
running. So
yeah. That's awesome. Well, I greatly appreciate you being a guest. I love what you're doing and being able to help people help themselves. It's a huge piece of and like I said earlier, like being in the health world and hearing all the different like people that talk about sciatica pain, lower back pain, and it's so needed for people to be
it,
able to get the
it's
proper help.
it's incredible how prevalent it is.
Yeah,
I mean, it's bizarre, and
yeah,
it should be something that can be easily taken care of when you treat it right.
yeah.
But like I said, it's the cookie cutter approach that so many PTs and chiropractors, massage therapy, everybody takes. And the one thing that I always tell people, if you've been given a bunch of exercises and you go online and type in sciatic or go on Google and just type in generic sciatica exercises and you see the same exercises that you've been given,
Hmm.
just know that those are not specific for you. Those are what
Right.
everybody uses to treat it.
Yeah.
And you're just being put in the sciatica box, which,
Yeah.
hey, you know what? I did that for 15 years and I was wrong, but that's all I knew.
Yeah.
So it's not your fault. It's not your provider's fault. It's just that's the knowledge we've been given.
Right.
So
Right. Well, I love finding people that are doing the way you're doing it. I sort of do the same thing when it comes to running. Like people ask me why I'm different, and I'm like, I'm a student of the game. I go in and try and figure out everything I can, and I'm always learning about it and trying things that are different and seeing if they work. And if they work, okay, well, I'm going to stick with that. And it sounds like that's where you're at, and I appreciate you for it. And we want to help you as much as we can. So thank you for being a guest.
I appreciate it. Thanks for having me. And any questions that you would have, always just feel free to reach out.
We'll do. All right. Thanks,
All right,
Dean.
my friend.
Thanks for checking out the Confidence Through Health podcast. Please subscribe, post a review, share this episode with those you love who need a little extra help with their health journey. Visit allinhealthandwellness.com to learn more about the coaching programs that I provide. All episodes are produced by the Social Media Cowboys, your source for all online marketing needs. Go to socialmediacowboys.com for more information.